Hey guys, it's me, Jess, or SOiTiSTrUe. Just want to make a quick video today because something that's happened to me today that I feel like I want to talk about it. It has to do with medication, post-gastric bypass. And I'm going to make a video to this as well, and it's going to be to the medication company, so you guys can watch that. Hopefully they will view that because really I have something to say. So to you guys, what I have to tell you guys is pretty, it's really pertaining to me, and I'm not sure if you guys have the same issue, but here's kind of where it's at. I fought for like a year or more, like a year and a half really, to get on a certain medication to that would help me be able to digest, well, help me be able to eat food without being in pain. A lot of you guys don't know is that for a long time after gastric bypass, I had a lot of problems. They had me take out my gallbladder, and it fixed a lot of problems, but not all of it. I was still having quite a bit of pain in my digestive tract. Every time I would eat something, I could feel it the whole way through. So we went through a couple different medications, found one that worked, and I wasn't in pain as much when I would eat. And I didn't feel sick. I didn't feel like I had medication in me. Like I felt normal. And that lasted all the way up until I fell down a flight of stairs. And when that happened, I had to be placed on a little bit stronger medication. But the medication, I still didn't feel like I was drugged. I felt normal. Everything was great, you know. Then they changed the medication. Here's my problem with that. Well, it's hard enough for gastric bypass patients to find medication that actually work. Kind of like different medications for like your blood pressure. If after gastric bypass you have to continue on blood pressure medications, quite often you're going to have to take double what you would normally take. And the reason why is because if it's anything that's supposed to last, kind of like let's go with if you have acid problems in your stomach, quite often you're going to take double what you would normally take. And that's because it digests so quickly as soon as it hits your large intestines, or it doesn't have the time to digest at all. So you only digest half of it, the rest comes out. So that's a problem that we have. That's something that you should be well aware of before having gastric bypass. That's kind of the reason why we have to take double our vitamins, stuff like that. And a lot of people don't realize is when you take your vitamins every day, you're supposed to stagger them out throughout the day. Like if you're supposed to take 2 multivitamins, you take 1 in the morning, 1 maybe midday or at evening. If you have to take double, your vitamin B or whatever you need to take, you really need to stagger them out. 1 every other hour, 1 every couple of hours, maybe 2 here, 2 here, 2 here, all the way down throughout the day. Because if you take them all at once, your body's not going to have what it needs to digest them all. So you're going to only end up digesting part of it. So if you're having a problem with your vitamin levels, chances are that's what you're doing wrong. So with that being said, this medication, they changed it. Here's how they changed it. They made it more of it became non-crushable. I guess people do some crazy shit, I guess I'll say. But what that did is it made it so it doesn't digest at all in my system. Like right now I'm in quite a bit of pain, and that's why I'm making this video kind of fast. So I apologize for talking so fast, but honestly, it's insane. It's insane the difference. The medication doesn't work at all. Not at all. And so I called the pharmacy, the company that makes it, and I said, hey, I want to talk to somebody who, gives their ass about their clients. I want to talk to somebody who cares. So they put me in touch with their doctor in their pharmacy. So I asked her, I said, listen, I had gastric bypass, which means I have part of a stomach. And that also means that even though I'm far out 3 years or so, my stomach never stretched. So, and on top of that, my new stomach is reattached further down in my intestines, which means that the smaller part of your intestines that generally digests things isn't there to digest it. The fluids still come down, but that doesn't give your body enough time to digest it in a certain area where your stomach really digests vitamins, pills, things like that. She said to me that it drives me up a while. When they did the testing, if somebody came in and said, hey, I'd be willing to do this to test the drug on me, but I had gastric bypass, they would dismiss them. Dismiss them why? Because somebody's handicapped, do you dismiss them? No, because it's illegal. So why are you dismissing a gastric bypass patient when, honestly, I'm going to guess that majority of Americans, and quite a few, are big. Hello, big. So what do they do to fix that? Well, if they have no willpower and they want to have gastric bypass, they do. So what does that mean? So you take away, the vast majority of big people that have done something to their stomach. So you take them out of that. Well, what about me? What about the little person down here that has to pay $2,000 a month for their medication or more, by the way? And that's only for one set for the month. So why would you do that? That makes no sense. So anyway, that's going to be in their video because I really have a lot to say to them. So anyway, yeah, that's something that I want you guys to know. Maybe we can do something. Maybe we can rally together and like occupy the pharmacy and throw eggs at them, I guess. I don't know what to say about that. But what I do have to say is that it's not fair, and I would guess that it's discrimination, right? I mean, that's not fair to me. Anyway, Bo's coming in with some towels, so I'm going to go. Look, this is my husband. Oh, he's such a good boy. He's going to give it towels. Look at the good boy. You did towels. Okay. Anyway, he's going to beat me for that. Not really. Anyway, I love you guys, and keep an eye out for my video towards the pharmacy people that make medication. It's not fair. It's not right, and I'm going to tell them all. Anyway, I love you guys, and there's my video. We'll be back probably tomorrow. I have a lot to say, and I've been missing a lot of videos because I've had a lot of crap going on, especially with all this nonsense. Bullshit! So it's being retarded. Love you guys. Bye.